Hi, I'm Dr. Alicia Rolaz. I'm a psychiatrist that teaches medical students at UCSF Medical School, and I'm also developing continuing education courses for Alliant International University. Today I'd like to talk to you about a study by Wayne Caton and colleagues out of the University of Washington. Now, Wayne Caton and I are actually psychiatrists that are subspecialty board certified in what's called psychosomatic medicine. Now, psychosomatic medicine is a newer subspecialty, just became official back in 2004, and it has to deal with what's going on in the body and how that affects the mind, and how what's going on in the mind affects the body, so how an illness in one would affect the other. So the recent study that was just published in the New England Journal of Medicine looked at how diabetes and heart disease interact with the disease of depression. So what we know is that people who have diabetes and heart disease are more likely to have depression and vice versa. And it's not as simple as saying that somebody who's sick would obviously be depressed. And that was thought for a while, but what we've seen is that certain illnesses are more likely to coexist with depression than others. And why would this be? Well, there's emerging evidence about inflammatory cytokines and how they may be responsible for many of the symptoms that we see in either case, either the diabetes and heart disease and or the depression. Inflammatory cytokines are released due to many different issues in our lifestyle. So stress can cause the release of inflammatory cytokines, illness, poor diet, lack of exercise, etc. So what we found is that people who have a lifestyle that causes a lot of inflammatory cytokines to be released are more likely to have heart disease and diabetes, type 2 diabetes. And they're also more likely to have depression. Now, is this an association or causation? It's not quite clear, but we do know that the two coexist. So what does this mean for mental health professionals? Well, what they found in this study is that if someone is addressing both the depression and the heart disease or diabetes, there'll be better outcomes in each. So what we often tend to do is we just address the depression, we let the primary care physician just address the cardiovascular disease, the diabetes. But if they're actually addressed together, there's going to be a little bit of a synergistic effect from the treatments. So in this particular case, in this study, they had a nurse who actually monitored and provided guideline-based care for each of these types of diseases. And what they found was that not only did the cardiovascular disease and diabetes measures improve, but also they needed less antidepressant medication, their overall quality of life improved, and they were more satisfied with their care in both their depression care and their diabetes or cardiovascular disease care. So as a mental health professional, I would encourage you to work closely with a primary care physician for any of your patients who have chronic disease. Not only will they be more satisfied with your depression treatment, but they may actually have better health outcomes as well. So this is Dr. Alicia Rolaz again. I look forward to talking to you soon, and I hope this has given you a little bit of food for thought. Thank you.